Hi guys, welcome back to my channel. I know I haven't made a video in a while, and this video was maybe to kind of explain some of that. As you can see from the title, I'm actually no longer a surgery resident as of a few weeks. And so I'm here to kind of explain that, which, to be honest, it's not that interesting as to why I changed careers in residency. It's more to explain for people who are interested and who may be interested in a career in surgery why it may not be for you, or why I personally decided after a few years that it wasn't for me anymore. So really, to make a long story short, I just discovered after a few years that I no longer saw myself doing surgery in the future. And not that I was in any way not enjoying residency or having a hard time during this journey, but thinking kind of more in the future, I just thought that it just wasn't what I wanted to do with my life anymore. And this came as quite a surprise. It really isn't something that was gradually coming on in my first few years of residency. So for some context, I did 2.5 years by now, and so I switched about halfway through the residency training program. And this started a few months ago, so right in the middle of the pandemic, and I woke up one day and I just realized, hey, like, why don't I want to be here? When I was in the OR, I was scrubbed in, and I just couldn't shake off this feeling that for some reason I didn't want to be operating, or it wasn't really doing it for me anymore. And I thought it was just a one-off moment, but during that entire week and being on call and being in the hospital, I just couldn't shake that feeling. And it really did kind of disturb me because I had to look and dig deep and realize what those reasons were. And that's the thing that's kind of common in surgeons and surgery residents, is that we are really obsessed with the operating room and the love to operate in all aspects of it, which is why we're willing to go through all of the kind of negative sides of surgery in terms of the long hours, the high stress, and the high learning curve and workload, because when we get to the operating room, that just really is rewarding and makes everything worth it. So what I realized was that once the obsession for the operating room decreases, even to the point where you're just interested but not obsessed, the scales tip really, really easily in terms of all the negatives that I just talked about. And I just knew from that moment that if I felt that way after just a few years in surgery, that in the future, I would most likely be unhappy being a surgeon, which was really quite shocking to realize a few months ago. And to me, the reason I think it happened during this pandemic is not really that it affected my work at all. In fact, COVID has changed the way we were practicing surgery and working around things, and more about elective surgeries and how those were scheduled and affected. But and I think that constant background stress of working at a hospital during a pandemic definitely was increasing the overall stress. But in and of itself, it's not really one of the reasons that made me reevaluate my career choices. But really, it's more that during the pandemic and just staying at home more, having more time at home, it really allowed me to take a step back and realize what was important in life and what I considered to be a successful career, or what I wanted to do as a physician, but also what I wanted to do with my free time and how I value that. So that really allowed me to have those thoughts and the time to think about it, because I think during residency, everything is just so go, go, go. Time really passes by super quickly because we work so much, and there's never that time to have a little bit of a breather and reevaluate where we are in life. And I think that, to me, that's how it came upon during the pandemic. But all in all, I know that this pandemic has been difficult for everyone for so many different reasons. Of course, relative to certain people's situations who have been sick, who have lost their jobs, I'm obviously grateful for where I am today in my situation. So I know I talked about the workload, the stress, the call that we do in surgery that residency in surgery is known for. I don't think that burnout was actually a part of the reason that I left surgery. I know it's a common thing that does happen, and it's super important to talk about it across all levels of training in all specialties. But to me, the residency was sustainable. I had time for myself. I felt like I was enjoying, progressing, and doing well in residency. And to me, it's not one of the reasons that I personally left the program. So I think you realize that a lot of these things are more just personal things that made me realize where I wanted to be. But certain things are, I think, specific to general surgery as a whole, as a discipline and as a career and a specialty where I live and practice anyways in Canada. And I made a video about this. I mean, it's been a while now. It was my last video, but I talked about how the training in surgery has become a bit longer due to a number of things, but mostly due to inflation of degrees across all fields, even outside of medicine. And so the training has, to me, become a bit too long to my liking anyways, or to what I expected my journey to be. And in a very concrete way, seeing the graduates from our program, which are only a few years ahead of me, seeing what they were doing with their training and fellowships or where they had their careers lined up, I was not interested in being any of them. And that's when I realized they all have such different career paths and choices, but I don't see myself being any of them. And so putting myself in their shoes, I just knew that I wouldn't be happy in the short term. Obviously, a lot of that has been affected by the job market and the opportunities that are different now during the pandemic. But even then, I didn't think that I wanted to be in one of their positions if I were to continue and graduate in a few years. And what I realized too is that surgery, because we work in hospital settings, the flexibility is not what I want it to be in terms of a future career. And again, that's what I was seeing from people who are getting jobs and where they end up and what choices they have. Obviously, it's like any job and again, any other domain where you don't always have a bunch of people asking you to come work for them, but you have to settle for something that aligns with your training, your skills. You might not end up in a big city or even in a suburb. And of course, if you want to go somewhere competitive, then that just means you have to train for a bit longer. And so the opportunities that I saw in surgical careers was not what I wanted in terms of the choice of a position in a job. And of course, that's just kind of seeing the future, that if you land somewhere and you don't particularly like the environment, the work, the people around you, I want to have the opportunity to adapt and change to do something else. And I just didn't see that opportunity being the case with general surgery anyways. Of course, being on call is something that I think I have to talk about. General surgery is a discipline that does a lot of call, and it can be very variable. Some people do a lot of call. Some people later in their careers decide to do a lot more elective practice and are able to take a step back from doing call. And when I first started general surgery, I was really ready to do call for my entire working career almost, that was what I signed up for and that's what I expected. Again, doing residency, doing 24-hour call about once every 4 days of working, to me it was sustainable. I was fine doing it, and I didn't find that it was particularly draining over time over the past few years. But the simple thought was just that when I'm 45, I have kids, I have a family, do I want to be at the hospital on the weekend if I'm getting paid for it? And to me that became an easy no. I know to a lot of people that can be easy yes, they would do that. But as a person, I've changed. As a physician, I've changed. And I realize what providing care and what I'm good at means to me. And again, going back to how I saw my time being valued and how I took a step back to see what I wanted to do outside of my career in medicine, I decided that I wanted to do something that had less call for my future self, really. So I hope that was decently clear. I know for people who aren't in my position in residency or in medicine, it may be something that's a bit more difficult to understand. But if you're watching it this far, I hope that it is interesting to you. Where am I going next? I actually just transferred to the same hospital, same university, but with a different program. I'm going to be training in family medicine. And that's a shorter program that I'm getting credit for because I've had already a few years of training, but it is a completely different specialty with new things that I have to learn and that I'm excited for, and that I think provide a lot of the positives of the things I'm looking for in a career, as I've listed and talked about in this video. When I was on surgery, I always loved the clinics. I always loved talking to people, getting to know people, and family medicine offers that flexibility of location, environment, practice, and I really think that I can find something that I enjoy within that. And the experiences that I have in surgery, in hospital medicine, adult medicine is only going to be helpful for offering me that flexibility to do whatever I want. So I'm really excited for this change. I think it's something that is just really good for me now and for my future self, and I'm really excited, somewhat nervous to learn all of these things again. But the whole process of transferring took a little while, but it's something that is quite common, as I found out, that people do just transfer programs when they realize that they're just not a good fit for the program anymore. And to finish off, I know a lot of people subscribe to my YouTube channel because they want that inside look into surgery and surgery residency in Canada. And so I'm not sure what kind of videos I'm gonna make in the future. I always have made videos that I would personally watch and that are interesting to me. So hopefully I can find something like that in my future career. But obviously this channel is no longer gonna feature surgery content, or at least not the day in the life, not the inside look that a lot of people subscribe to my channel for. So hopefully you stick around, and thank you for watching. I'll see you guys in the next one.